Hi, Hira. My name is Tina, and I'm going to be your occupational therapist. How are you doing today?
I'm doing well. How are you?
I'm doing good. Thank you for asking. So, after reading over your chart, I see that you have right upper extremity spasticity. Could you tell me a little bit more about that?
Yes, I had a stroke about 3 months ago, and I have a lot of tightness in my arm, my right arm, and it's kind of hard to move when I'm doing things.
Okay, and do you feel any pain at all?
It's not pain, more as like a discomfort, because it is so tight, and I'm unable to move it when I do things, so it's kind of uncomfortable.
Is it affecting any of your daily activities currently?
It is actually it's kind of hard for me to like dress myself in the morning or like to take off my clothes at night or when I'm brushing or washing my face and brushing my teeth in the morning. It's hard for me, and especially when I'm in the shower, it's very hard to bathe, to cleanse my body and my hair when I'm in the shower.
Okay, so what we're going to be doing today is going to help work on getting kind of mobility back into your arm so that you can kind of be a little bit more independent in all of this, okay?
Yeah.
So I wanted to ask, are you able to open your hand and extend your arm out in front of you?
I am able to open my hand with a lot of difficulty. I noticed this especially when I was playing cards with my friends a couple days ago. I wasn't able to pass out the cards as efficiently as I used to. And I think about a week ago, I was trying to pour myself a cup of tea and it just spilled all over. So it didn't work out very well. And also when I was gardening, it's a nightmare. I can open them and I can reach, but it takes a very long time and it's very hard for me.
Okay. Are you experiencing any impaired sensation at all? Like, can you feel everything that you touch?
Like in my hands? No, it's fine.
Okay. Are you having any visual impairments?
No, no.
Okay, perfect. So based off of what you told me, I want to introduce you to something called robotic therapy. What this is using a robotic device to provide repetitive, intense, and interactive training in a controlled environment. It helps increase your motivation and promotes motor control and improve muscle strength and tone. So your recent set of vitals look stable and good. I see that you have no orthostatic hypertension, no fractures or any skin lesions. You have no severe contractures and you have no history of vascular or circulatory disorders. So is there anything that's not noted in your chart that you would like me to know before we get started?
I think you got everything.
Okay, perfect. So for today's session, we're going to be doing robotic therapy. I'm going to go over a little bit about like these devices. So there are two types of robotic devices. First one is called the exoskeleton, which attaches your whole arm, starting from your proximal area, so your shoulder, all the way down to your distal area, which is like your wrist.
Mhm.
And then the second device is called an end effector, which attaches only to your distal area, so only at your wrist. And it kind of helps your upper arm movements. So today we're going to be using the end effector device, and it has four different types of modes. So the first mode is active assistive mode, where the robot adjusts its force in reaction to your movements. So it will only assist you when you're unable to perform the task voluntarily. So if you kind of deviate from a target, the robot will assist you back on track.
Mhm.
The second mode is non-active mode, where the robot provides gravity support to move against without experiencing gravity.
Mhm.
It's going to help support your arm, and it's going to it's going to require less effort from you.
Okay.
Okay. And then the third mode is passive mode, where the robot exerts power and force to move your arm, and it's going to kind of guide you in the direction of the desired target. So you're going to get used to that motion. And then
Mhm.
the last mode is resistive mode, where the robot adds resistance to each of your movement. It kind of challenges you while you're like moving, so it can build up some strength.
Okay, that sounds
Okay.
good. Mhm.
So the mode that we're going to be picking is going to be dependent on your current ability level. So from what I've seen, we're going to start off with non-active mode. so that you're gonna just be moving your arm through space, and then I'm gonna gauge kind of where you're at, and then we can change the modes according to your needs. So I'm looking more towards non-active mode first, and then possibly switching to active assistive mode, but we can make adjustments as we go along through the therapy.
That sounds perfect.
All right, so setting up for this device, you're gonna wanna be sitting up tall in an adjustable chair so that your feet are flat against the floor, and you're gonna be sitting in front of a monitor screen that displays the goal-oriented exercise game.
Mhm.
The seat also has a seat belt in case you do use trunk compensatory strategies. So like if you kind of lean in with your body to kind of reach, that seatbelt is going to kind of restrain you from doing those actions because you want all your actions to come from your arm. Okay. You will be placing your right arm into the base of the end effector with your elbow slightly bent and your wrist in neutral. You're going to grip the robotic handle with your hand, and you're going to kind of maneuver the handle with your hands.
Okay.
So
That
the
sounds good.
purpose of the exercise displayed on the monitor is to move the robotic joystick to the appropriate colors on the screen. So it's going to prompt you with what colored objects you want to click on. And then you're going to see some objects with those colors falling from the screen, and you only want to click on those objects of that color. So you don't worry about missing any of them that kind of you're not fast enough to click on. Just focus on kind of selecting the right colored objects.
Okay.
Does that sound good?
That sounds good.
Okay. Okay, let's get started. So do you see the screen clearly?
Yes.
Okay, so for this task, you're going to want to pick all the purple objects. So whenever you're ready, go ahead and click the green button.
Okay. Mhm. Oh. Okay.
Yeah, don't worry about the ones that you missed. Just focus on the other purple objects.
Oh, okay, got that.
You're doing great.
Where I think they come is not where they come.
You want to focus on your movement and then on your accuracy.
Okay. It's very hard to control.
You're doing good.
Oh, oh, oh. Mhm. Oh, yes.
Wonderful. So how did that feel?
It was okay. It was a little difficult to handle. I think, yeah, I think I just can't get it in the middle. Like the ones that came in the middle, I couldn't get to them. I'm too like going either to the left or to the right, like really not being able to control it.
Okay, so then we can switch it to active assisted mode. So the robot's going to kind of guide you a little bit more and help you with those movements and kind of put you more on target. How does
Oh,
that sound?
that sounds better.
Okay, so this is the active assisted mode. So the robot's going to be kind of guiding you a little bit more in your movements. And if you're kind of missing the target, it'll help put you on track to where the targets are. Okay.
Okay.
So for this task, you're going to pick all the yellow objects. You can start whenever you're ready by pressing the green button.
Okay, I'm ready. Oh, wow. Okay, this is different.
Do you feel more fluid?
I definitely feel more fluid. It's definitely helping with my control.
Okay, good, good.
Oh, nice. Okay. Next one. Oh, got it.
You're doing great.
Hmm.
It's wonderful.
Almost there. Okay.
All right, perfect. Now that we're done with this, do you have any questions for me?
No, that was a great activity.
Okay, so then we're gonna be wrapping it up with robotic therapy, but I'm also gonna educate you on some stretching and strengthening exercises, okay?
Okay.
All right.